One of the most important parts of my job is knowing when not to operate. These include patients that may have unrealistic expectations about their outcome. Some things may just not be achievable surgically or may make you look completely unnatural. I want you to look as natural as possible while keeping balance and facial proportion. And I want to be extremely honest with you about what is actually achievable with surgery. Another reason I would choose not to operate is if it's something that is out of my skill set. Being a facial plastic surgeon and having trained in head and neck surgery, I'm very comfortable with a variety of procedures, almost anything in the head and neck. But there are some things that are so difficult that only a few experts in the world should handle. A case in point would be a patient requiring a third, fourth, or fifth rhinoplasty. It becomes incrementally more difficult after each one. There are only a handful of surgeons in the world that are truly qualified to do a great job. And then the final thing is timing. From a timing standpoint, if you've never had surgery and you're rushing into something spur of the moment, that's always a red flag to me, because these types of surgeries are always completely elective. There should never be a sense of urgency of trying to squeeze it in at the last minute. It should be a very deliberate and well thought out decision. On the flip side, if you've had surgery and things did not turn out well, it's very common to want to do something about it as soon as possible. But unfortunately, the wound healing process typically takes up to a year to completely finalize, and a lot of changes will happen during that time. And in general, many of the issues that patients see very early on tend to dissipate or improve dramatically with time, so it might save you from having an unnecessary surgery.